Okay, so, team, how'd that go?
They did a great job.
They did good.
They did well.
You did a great job.
Define great job.
Much more organized than the first time.
Than
that
when
ever
we
did
did
this.
it. Because we were
And I
the
can
first
say that, yeah,
group.
because that was
We
my
were the
group.
first group that went.
They all had their own little like role, and I thought that they did wonderful.
Great
Wonderful
teamwork.
job.
Yeah.
Okay.
Very thorough.
Yeah, everyone
Seemed
had
like
like their
they-
job and everyone did their job.
They did everything they were supposed to.
Very
Like
Asked
the
all the
assessment,
questions.
Very
vitals.
thorough.
You hung the
That's
bed. Pete went and hung the bed and.
I had no idea. Pete like hung it so flawlessly. I was
Yeah.
like, do you need help?
It
He's
was
like,
too,
"No,
almost
it's
too
done."
simple.
I mean, yeah, he was back there.
Yeah, you-
we
you
were like,
can figure
oh,
out set
there's
up,
Pete
it's
in the
not
corner.
even-
Like,
Pete, did you program the thing? Just one.
No, it was already running.
Oh, okay. So you just like
Yeah.
happened.
we
Yeah.
were like, oh, there's Pete so smoothly in the back just doing
Oh my
it.
God, I was
Like,
like,
like hiding in the corner. And you guys were just doing your thing and it worked.
Okay. So, I thought it looked fairly good for a novice-looking group of people. From a professional angle, is there anything that we perhaps would have wanted more to know about there in an initial history?
We were having trouble hearing for the
Okay.
initial part, so I may have
Oh.
missed some things.
I talk low.
So does what
It was,
So
it
does
was
mine.
all like the
Yeah.
the whole
The
volume.
one's
We
bad.
found 3 volumes, and then we could hear a little bit, but yeah, soft spoken is good. So I didn't hear if we checked for allergies before we hung a medication, and I didn't see
I
that.
thought, I have, yes, they did.
Oh,
We-
great,
Yeah.
okay, I missed
Yeah.
Yeah,
that.
you walked in and asked before I was putting my gloves on.
Yeah, just,
Great.
just to be sure.
Great. And I was watching the fetal monitor. I did see somebody look at that, but I couldn't hear if there was any discussion about it.
We did.
And two of them were really looking at it and processing. I could hear that they were saying, this is happening, and there are accelerations. And I thought that was,
Well, she asked us, is anything wrong? I'm like, no, we're just looking.
and that's good because patients will notice where you're looking in the room.
Yeah.
And I thought that you did a really nice job of assessing without getting excited. And you're over processing as if you were to work in this line of work, a lot of times you do stand over there and really stare at that Tracy because you want to be able to say exactly what you were seeing if you're charting it. But I thought you did a nice job of assessing but not being super obvious about it or looking like you were only focusing in on the chart and not the person.
I have a question about the fetal monitoring. Was it just a plain, like with the heart rate and the contractions? Was it just like, boom, there it is, it's not moving? Because it wasn't moving on our screen. It was just like there. And like the heart rate was moving and like the contractions.
You did not see accelerations
But
in
it
here?
wasn't, it wasn't going like this. Like it wasn't like,
It was like a snapshot.
it was just a snapshot. It was like, boop, there it is.
One time?
It was all it
Or
was.
did it change over time?
It did, it stayed the same.
Okay, so you're not seeing what we're seeing in there.
No.
So we'll find out about that.
But like the numbers were changing.
But
I was
not
like, oh, so the heart
visual.
rate looks good
Okay.
from what we can see,
Okay,
but
good.
it wasn't actually like moving.
Good. Well, that's one of those things that happens with Sim sometimes and all this technology. Sometimes it really works well and sometimes you have to kind of go with it. How did it feel to be in there trying to assess? Did it start coming back to you what we were looking for? And what had matched, did it match with what you remember from reading and prep the last time?
Yeah, pretty much. It was like a little, with 4 of us, it was,
It's a little artificial.
yeah, exactly.
Yeah.
So like we tried to sort of have Leah do the history, but I wanted to know a little more like, information about what was going on like currently. And so, I don't know, I thought we tried to, it's just hard, I think it's hard for like,
Has anybody else worked in this or had a baby? And in that first going in and meeting people, what other questions might we want to ask somebody who is just in for that first time and you're trying to establish rapport with the patient? What else have we done? What could we do?
Well, I thought just because I thought personally there was just too many people for that scenario, but then I thought maybe, because there were so many people, maybe somebody could have provided some teaching about what to expect, what's gonna maybe happen further on, if there's any other people coming in who they might see, who they might not see.
Okay, great.
We discussed this while they were in there. Like one of the big things was talking about her previous pregnancies because this was her 4th time and she did have, I think we determined a preterm, a term baby, and then she lost a baby. So, and I do believe I heard you guys asking about like bleeding and things like that with her previous pregnancies, which is important. So.
What I heard that too, but there were some other things I might have wanted to know as a nurse about that. So, what do we remember we got from the patient?
Yeah, they were all vaginal.
Yeah, but
Very,
what about the
unremarkable.
bleeding?
The bleeding.
Like the
I
amount?
asked her about the bleeding. She said that if there was interventions, there
Yeah.
was, and she didn't know.
She said that there was a lot at first, but she said they stopped it and she doesn't know how.
She's like, I can't tell you with that information. I
That's
don't
what she
know.
said.
If she received like a blood transfusion or something. She did not receive a blood transfusion. They stopped it, probably like meso or something. She just couldn't tell us.
She didn't really know at all.
So I don't know if it would have been in history,
Mhm.
if we would have been investigated. I don't know. But
One of those, I don't know if it's changed too, but a lot of times there's the postpartum hemorrhage and it takes a lot for anybody to even admit that it happened.
We're trying to change that culture. The bigger insurance carriers are constantly educating physicians and nurses with required modules to call a postpartum hemorrhage much faster than we used to. But that's a good way to describe it. Oh, she has a little heavy bleeding, but we never want to call it a hemorrhage.
Okay.
So she may never have heard those terms.
She may not know, and that's the worst part, is that people can have those and not know that it happened, because I don't know what the big deal was, because the doctors had to then write a lot more stuff if something, if there was postpartum hemorrhage. So a lot of times we're eyeballing, we never really measured, although they're spending a lot more time measuring now, and supposed to be able to get pretty good at that, yes.
I take modules where they show blood on pads and I have to estimate it, you know, oh, if it's this size, it's,
This many cc's,
It's a lot.
it's this much, it's this many cc's, yeah.
I think they just don't also, because I had a hemorrhage after the first child, and that was obviously a long time ago, but I did not even appreciate what really happened until this OB class, because they don't really explain to you what's going on.
Yeah.
You know, I never had Pitocin ahead of time, but afterwards, there was all this flying around the room, and it's like, start the Pitocin, and this woman's grinding her knuckle, you know, I'm like, what the hell's going on? And no one explained it really. I didn't know why they were doing those things until now, and I have no idea how bad it was, actually, let's put it that way.
What you guys were talking about, because I didn't hear that part about the bleeding.
Oh.
Like whenever you guys were talking about it, I couldn't hear what you guys were talking about with the
She
bleeding.
was just saying, I asked, and I said, well, I think I said how much, and she said, well, I don't know how much, but it was a lot at first, but then they stopped it somehow, and she's like, I can't tell you how they stopped it, she didn't remember.
They don't explain to
Or
you
just
how much it
one of
was
her
and how they,
kids?
Yeah,
just
one,
one,
the second one.
details.
Okay.
23 months ago.
And then she asked how long ago that was, and she said 23 months ago.
Oh, okay.
And what is important about knowing how long ago that happened?
Overstretch, overwork the uterus.
What if it just happened 9 months ago?
That happened
Then
again.
you're at a higher risk.
High risk, your body needs time to heal.
If she said 9 months ago, when her H&H came back, I would really be looking at that. Because did she even have a chance to build up again? Is she already anemic when she started the pregnancy, and she had no prenatal care?
Maybe let like blood bank know. Maybe let blood bank know, would you let, so that maybe she might need.
A lot of times in your standing orders, there'll be stuff as
Oh.
H&H X, do type and cross for something, type and hold. So you're ready in case something happened. Is there anything else, Sue, that we would want to say about that in history?
No, not with the history. The one thing I was thinking though is you hear from a patient's perspective what she didn't know, and hold on to that as nurses, that you want to change that, and you guys are the ones that can. You're going out there, educate your patients, inform them what's going on. Don't only take your lead from those of us that have been doing it forever when you're on the floor and stuff, but carry some of this with you.
Because it is her body. It is not our body.
Just to add to that, we had a patient, Jamie and I, in the ICU, and she was, who delivered while we were there, just for our rotation, and they ended up giving her misoprostol afterwards, because she was having, this was this woman's 4th child. She didn't seem to be in a lot, but she was basically on her phone contacting people or doing things. I would bet she doesn't know she was given misoprostol, or she would not, I bet she doesn't know, even today, now, I bet she doesn't know really what happened or what was going on, or you're kind of out of it too. And so unless someone really takes the time to explain it to you after the fact, then, you don't realize.
Does anybody not know what misoprostol's for?
We all know.
Okay.
What's another name for it?
Cytotec.
Great. Let's see, the other thing I thought about, so I noticed, I liked how you checked the ankles. What were you looking for with the ankles?
I was looking for, edema, but also, clonus.
Okay, and I heard someone ask about eyes and
I
other
was
stuff.
seeing any, Leah did.
And what were we checking for there?
Yeah.
Yeah.
Neuro stuff, hypertension.
Very nicely done. Didn't raise alarm. It kind of all fit with everything. Is there anything else we would have wanted to know for somebody who came in with no prenatal care? Anything else you can think of?
No, but I think, but not to this question, but I think I probably should ask about like her support with someone coming in, and
I wanted to too.
And I forgot.
Then Dr. Edrin came in. I wanted to ask about that, like, is someone gonna be here with you? That was gonna be my next thing.
yeah, if you needed us to make a call.
Are they parking the car?
Yeah, like
Right.
where, yeah.
Are they trapped trying to do, insurance?
Right. Yeah,
What's
yeah.
going on?
You
So.
asked about birth plan though, didn't you?
I did.
I think, did you guys ask, you asked if you felt the baby and she said no or something?
She said yes.
She said,
I thought
I
she said-
have,
Did
but
she
not
say-
now that I'm having contractions, or
Oh.
something like that. She's like, well, I have felt it but now I'm having these contractions.
Contractions make you
Was there
think
anything
of
that you were
something
thinking
different.
with her not having prenatal care? You asked a question about.
The things that were no prenatal care, a lot of times I'll say, was that because I just want to kind of get a feel for what's going on. Does she did not have insurance, been on a move, hates medicine, and only came in because she thinks she had to at the last minute. She was going to deliver at home. I've had, my experience is I've had families bring people in at the last minute. They were going to do a home birth. They didn't even want to go to the medical system, and then got scared at the last minute. It's nice to get a feel for how come, just so that you know what you're dealing with there. And you'll hear all kinds of interesting stories. Always just good to, never hurts to ask.
So how do you ask that question without sounding judgmental?
Just-
Because I feel like,
It,
if
well,
you
you,
say like, well, you had no prenatal care, like why? I feel like that could come off as judgmental. Do you see
what do you think?
Can you tell me a little bit about your prenatal care? And then maybe she'll go in and say like, oh, I didn't have prenatal care because, or then if she said like, I didn't have it, can you say like, can you tell me a little bit more about why?
She had something, because I asked about the pediatrician,
Yeah, she said, I'm going to who I take my other kids to.
and I said, oh, can you tell me more, like, which one? And she said, Sewickley Valley.
Wait, okay.
And then, I don't know why I didn't say it. I thought, did I not ask that? I might not have. In my mind, I did.
So anybody else have a suggestion here? Because that's a
I
good
wanted
question.
to ask about that, but I didn't want to come off as being, like you said, like, so why didn't you get prenatal care? I didn't want it to come off sounding like that, so I didn't ask it. But I was curious to, like.
And you can just say, I'm curious. Tell me more about that. No prenatal care. People will tell you. And if you just, I always think, get curious. Get curious. And if you come at it from a curious thing, people want to tell you. And if they don't want to tell you, they will tell you. And sometimes the hand goes up, I'm not talking about it. Okay.
And as long as you're polite, it's okay. We need to let them know you really should get prenatal care. I think sometimes we're so careful not to be judgmental that we're not really telling them what's best for them because we don't want to appear judgmental, And there's a nice way to do that with no judgment. It can be done, but it works better once you've established rapport, once you've established that you have respect for her and you're kind, and then you work those into the conversation. You have a little bit more room to go in, and that's something you'll get over time.
So let's go to that point just a little more, Susan.
Okay.
What are some other things you can do to establish rapport? I think we had a nice task list here that we knew we needed to get through, but if I was gonna work on rapport, what other things do you remember what we would ask somebody to kind of, and you get this down if this is your line of work, you know these questions you're gonna ask.
Ask you about the baby. Is it a boy or girl? Do you have a name picked out?
Yes. Good.
Mine wasn't really asking a question, but I know like, talking to patients before that they said that like, they're kind of able to trust their nurse more if they do what they say they're gonna do, like, oh, I'll be back in 15 minutes, and then they actually come back in 15 minutes, you know, where they kind of have that, they trust that they're gonna do what they say they're gonna do, so it's not really asking any questions, which is
Right, so
being
that helps establish
consistent in your
rapport,
care,
right?
Asking like how they're doing, is there anything that I can do for you? Do you need anything or just?
What other questions could we ask about kids at home? Boy or girl at home? Excited about baby brother or sister? Acknowledging that there are other kids around, and is this going to be a welcome thing for a brother or sister, or are they not anticipating this with great joy or not? How old are other kids? Those are all things when you see that history that you can start asking. If anybody's a mommy in here, all those mommy questions.
Do you have help at home?
Do you have help at home?
Will you have any help coming?
Do you have a relative, do you have help coming? Sometimes it's, oh yes, my husband's mom's coming. And you can just see by the look, oh, that's not good. So is that really help? Those kinds of things help establish rapport and that bond of, okay, we're in this together, and we know that this kind of thing is happening.
I always go straight to the other children because they're excited to talk about their kids. And for lots of them, it's the first time they've been away from their 2-year-old, and they just love you because you've shown interest in the thing that's most important to them in the world, and that would be their baby at home. So.
And they've got heightened sensitivity to everything at that point, so you don't know if someone's going to burst into tears at a moment's notice or whatever, too. So, you can get a whole lot and you want to be reading her body language. She was kind of laying there looking pretty comfortable. Yeah. So when we go in again, let's see if that's changed or if she's anything's going on there. But you're kind of getting a whole aura of the room as a labor and delivery nurse, kind of like in the ER. Those two things are pretty closely related. You get a gestalt of what's going on, and you read people as they come in, and you watch reactions as people come in for those kinds of things. Has anybody had that experience?
What? I'm sorry.
Of a family member arriving or someone else, somebody else arriving, and suddenly the room changes. And you know,
Yeah.
what?
Like tension.
Something's going on. So good to know.
Rigid.
Oh, yeah. So in that area particularly, very important to be able to read the room. So good job, and we'll carry on.
Okay.
Good job, guys.
Right. So moving on.
The next group is Davis. Is it Callias?